We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to find out if her medicines are covered by a specific plan, we searched for health plans available in Wisconsin. We used healthcare.gov for our search because Wisconsin uses the Federal Healthcare Exchange. We narrowed the search to Madison, zip code 53704, and identified as a 52-year-old non-smoker making $51,000 a year. 85 health plans are available from 4 different insurers. We narrowed that down to just silver plans, since those have been the most popular with consumers. There are 35 silver plans available. We tried the silver plan with the lowest premiums and the one with the highest premiums, each from a different insurer, to find information about medicine. It was great to see links under each plan for a list of covered drugs, making it easy to start the search. For the first insurer, the link for covered drugs opens to a website with 6 options for a list of covered medicines. The first one is a 4-tier formulary, including policies from healthcare.gov. We selected that, and it gave us 3 options. We selected the 4-tier formulary. That opened a 112-page document. There is a helpful note up front explaining how to search the document for a specific drug. Otherwise, all the medicines are listed in alphabetical order, so a consumer would need to scroll through the list to find specific medicines. Each medicine has a category assigned to it. Though there's no information up front describing this, on page 45, the document organizes medicines into those categories. This is handy if a consumer wants to see all the medicines for a particular condition, like diabetes, that the plan covers. The challenge for consumers, though, is that the category names are not consumer-friendly. For example, a consumer would need to look under anti-hyperlipidemics for cholesterol-lowering medicines and anti-neoplastics for cancer medicines. In both ways the medicines are listed, the document has a column with a tier and a number or letters under it, and a special code column. Both relate to a patient's access to the medicine in terms of out-of-pocket costs and whether limits on coverage apply. One of the abbreviations under tier includes NC, described at the bottom of the page as not covered. That means though the medicine appears on the list of covered drugs, it's not necessarily covered. That's confusing for consumers. Other tier numbers relate to the consumer's out-of-pocket costs, although that's not explained in the document. We also tried the Quick Reference Guide, which is a shorter version of the formulary, but includes a disclaimer up top that not all the medicines are listed or covered. This document uses more consumer-friendly terms in terms of the categories, but it's not a complete list. For example, there aren't any cancer medicines listed at all. We went back to the exchange and tried our search for covered medicines with the silver plan from a different insurer. The link to a list of covered drugs opens a document labeled a 4-tier formulary. Despite the title, the document describes 5 different tiers on page 4 of the document. The document is also more than 50 pages long and lists medicines alphabetically in tiny type. There are no instructions on how to search the document for medicines by name, so a consumer would have to scroll through the list to find medicines unless she knows how to use the find command. Each medicine has a tier number, which is explained in the document as relating to a consumer's out-of-pocket costs. Several medicines have NC listed under tier number. According to the document, NC stands for not covered. So although a medicine is listed on the list of covered drugs, a consumer has to make sure it's on the list and isn't labeled as NC. That's confusing for consumers. There is no way to see all the medicines covered to treat a specific condition either, like diabetes. A consumer has to look for each medicine individually. Many challenges face consumers trying to find out which health plans cover their medicines.